Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about celiac disease. In particular, I will cover what is celiac disease, how do you treat celiac disease, and how you can better live with it. So we start with what is celiac disease. Celiac disease is a condition that causes inflammation in the lining of the small intestine. It's triggered by consumption of the protein gluten. And gluten is found in bread, pasta, biscuits, pizza crust, and many other foods containing wheat, barley or rye. Celiac disease is not a food allergy or a food intolerance. It is an autoimmune disease, which means that the immune system, which normally protects the body from infections, mistakenly attacks itself. The lining of the small intestine contains millions of tiny tube-shaped structures called villi. These help food and nutrients to be digested more effectively into the body. In celiac disease, these villi are flattened due to the inflammation of the lining of the gut. This then means that the food and nutrients cannot be so readily digested into the body. No treatment can cure celiac disease. However, you can effectively manage celiac disease through changing your diet. The inflammation in the lining of the small intestine stops food from being properly absorbed. You then do not absorb nutrients very well into your body. A variety of symptoms may then develop. Symptoms first develop soon after weaning, when the baby starts eating solid foods containing gluten, so it starts that young. So some of the symptoms then would be the baby may fail to grow or to gain weight. As food is not being absorbed properly, the feces or stools may be pale and bulky. Smelly diarrhea may occur, and the abdomen or tummy may become swollen. The baby may have repeated vomiting as well. So the symptoms of celiac disease in older children may be similar to those in babies. Poor absorption of food may cause deficiencies of vitamins, iron, and other nutrients. This may cause anemia. As the fat part of the diet is poorly absorbed, the feces may be pale, smelly, and difficult to flush away. Diarrhea may develop. However, the symptoms may not be very typical or obvious. If the gut and bowel symptoms are only mild, then the first thing that may be noticed is poor growth. In adults, poor absorption of food may cause deficiencies of vitamins, iron, and other nutrients. Anemia due to poor absorption of iron is common. Other common symptoms include abdominal pain, which tends to come and go, excess wind, bloating, diarrhea, tiredness and weakness. There's also mouth ulcers, and you may lose weight due to poor absorption of food. However, most adults with celiac disease do not lose weight and are not underweight. Occasionally, an itchy skin condition called dermatitis herpetiformis can occur in some people with celiac disease. If the common symptoms described above develop, the diagnosis may be made quickly. However, common or typical symptoms do not always develop. Particularly in adults, the areas affected in the gut may be patchy. Symptoms may then be mild or not typical, and it may be a while before the diagnosis is made. So next is, how do you treat celiac disease? The main treatment for celiac disease is not to eat any food that contains gluten for the rest of your life. The symptoms then usually go within a few weeks. The main foods to stop are any that contain wheat, barley or rye. Many common foods contain these ingredients, again, such as bread and pasta. Foods made from oats are usually safe to eat. However, some people with celiac disease have symptoms if they eat oats. Potatoes, rice, maize, corn, fruit, and dairy products and soy-based foods are fine. Avoiding gluten is for life, as I said. If you get gluten again, or if you eat gluten, symptoms will return. Even small amounts of gluten can sensitize the gut again. To avoid symptoms and complications, you must be strict about avoiding all foods that contain gluten. Other treatments, in addition to avoiding gluten, you may be advised to take some vitamin, calcium and iron supplements, at least for the first 6 months following diagnosis. This is to replace any deficiencies and also to make sure you get enough of these whilst the gut lining is returning to normal. Having celiac disease can cause your spleen to work less effectively as well, making you more vulnerable to infection. And lastly, how do you better live with celiac disease? Following a gluten-free diet may leave you frustrated, and understandably so. But with time, patience, and a little creativity, you'll find that there are many foods that you can still eat and enjoy. So here's some tips to help you on your way to a safe and healthy diet. So read food labels. Food labels are your lifeline to better health. Always read the food label before you purchase any product. A food that was once gluten-free no longer may longer be. Next is call the manufacturer. Some support groups produce a gluten-free shopper's guide that can save you time at the shop. And don't be afraid to eat out. Through preparing your own meals is the easiest way to monitor your diet. This doesn't mean you can't eat out. For an enjoyable dining experience, remember the following advice. Select places that are specialists in the kinds of food you eat, and visit the same restaurants so that you become familiar with the menus and the personnel get to know you and your needs. And finally, before I finish, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing celiac disease more effectively. We have various supplements which you can purchase from us without a prescription, such as gluten-free multivitamins and gluten-free iron, and much more besides. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us, and we help you to increase your understanding of your illness. During a telehealth clinic, together, we create a cohesive management plan which enables you to take a more active role in managing celiac disease with confidence. So call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.